As COVID-19 virus havoc is being contained with the introduction of vaccines across the world, telemedicine is also stepping up into the spotlight and helping healthcare providers as well as caregivers better respond to the needs of the people. Well, joining us now is Ifeanyi Ossai, founder and CEO of CribMD, a doctor, house call and telemedicine company. Thank you so much, Ossai, for joining us today.
It's a pleasure to be here. Thank you for having me.
Well, telemedicine seems to be having the spotlight, as I've already said in that introduction, now ever than before, thanks to the pandemic, I guess. But has this really made any difference? Is it reducing risk of infections and saving physicians?
Telemedicine have had a tremendous impact on the healthcare system globally and in Nigeria, since the pandemic, because one, it lets more patients be able to access a doctor without being exposed to the hospital environment, where they're more likely to catch COVID or during transportation. Say you're taking a bus in Lagos, for example, to get to the hospital. Imagine how many people you're being exposed to or can expose the virus to. So telemedicine has been exceptionally tremendous during these last few months, and we've seen heavy adoption.
Speaking of heavy adoption, I'm more interested in knowing, how old is the concept of telemedicine? Before the pandemic, how, prior to now, what kind of efforts were being made to bring it on stream and why? And then, also a second question, what about people in remote areas? How does telemedicine make medical services accessible to them?
So that's a two-part question. I'll answer the first one. So how new is telemedicine? So it's been around for a while. The technology obviously hasn't caught up to where it is now before. But our investor, for example, Joe, was a former U.S. diplomat when he was stationed in Nigeria. And when his kid almost died in the country because he could not see a doctor, and he was able to phone an American doctor in the U.S. who was able to help him. So why it is not telemedicine, like video calling like you know it today, it was a form of telemedicine visit that saved that kid. So over the years, as streaming and a lot of things became more popular and the tech tools were built, telemedicine became more dominant. But it has been more popular this last 2 years, mostly due to COVID as well.
What about accessibility for people in remote areas?
So in terms of accessibility for people in remote area, one thing we do at CribMD, for example, is some of the population at the base of the pyramid. And the way we do that is we have a toll-free number where those people can be able to call into. So they're not charged money, so we get charged, right? And they can call into our doctors to get care when they need it. So you will not be able to do video calls because usually the telecom infrastructures in those areas will not support like 4G or 3G video calling.
So can virtual visits to the hospital replace physical visits? I don't know if everyone is latched onto this, but I guess some is seeing is believing. Until I see my physician, I don't think he understands what's going on with me. So do you think this will outlive the pandemic as well?
Definitely, because so take CribMD, for example. One thing we do is doctor home visit and telemedicine.
Okay, great.
So when we see a patient at the comfort and safety of their home through a doctor house call or doctor home visit, we're able to look into their social determinants of health. We're able to build that bond with them to get to know the patient, and the patient gets to know the doctor, and they build that trust. So subsequent visits over telemedicine are usually more tolerable because this is somebody this is somebody you trust. Right, so this is the way we see medicine going forward.
Do you think we can keep this momentum? Will it outlive the pandemic?
I do believe it definitely outlived the pandemic because a lot of our adopters, they just love being able to see doctors at the comfort and safety of their home. Just imagine traveling from the mainland to the island here in Lagos. How many hours does it take? If a doctor
I know that traffic.
Yeah, so yes, at least in Nigeria, to outlive the pandemic.
Okay, that's good to know. What are some of the challenges? Because I'm thinking of, we're very poor in data gathering. What are some of the challenges the pandemic and the demand of the pandemic has thrown up that you're thinking we need to improve on this if we're going to offer a more effective telemedicine service?
So in terms of the challenges the pandemic has thrown up, I would guess for the most bit is access to hospitals became more high demand. I was reading the other day, people were paying $10 million hospital beds, right, to get a hospital bed. That's just insane. So telemedicine has, solved that. Some of our customers, like IHS, the build towers, for example, they also are working with various community, and part of their corporate social responsibility is working with companies like CribMD to, give healthcare to, the base of the pyramid and help those people. So things are in the work.
Yeah, we're out of time, but we're really appreciative. It's good to hear what you're doing.
Absolutely.
I wish you the best of luck with what you're doing.
Yeah.
Thank you for coming.
Pleasure. Sign up, John, and we'll see you.
Yeah.